We work with both the upper limb and the lower limb amputee patients here. Occupational therapy is about facilitating independence following injury or an illness or disability, but in this case obviously it's amputation. So with the lower limb patients we will look at everything from accommodation, adjustments, adaptations, activities, whatever activities are meaningful and purposeful to an individual, maybe sport or hobbies, things like that, and vocational rehab. So we assist people in any aspect of their day-to-day life really. So with the vocational rehab we do that with both the upper limb and the lower limb amputee patients. And that's to assist them back into the workplace. So if they are already employed or still employed, we will liaise with their employers, do a work site assessment of the work environment and make adjustments and adaptations there, whether it be equipment or to hours and duties. So in the clinical environment we've got the room set up so that it kind of simulates some of the home environment, so the kitchen for example, dressing and clothing, those kind of areas. So we can simulate and practice people's abilities to carry out simple cooking tasks and things like that. We can trial equipment within the clinic setting. We can look at standing tolerances and things like that for the lower limb amputees. For the upper limb amputees, it's about using adaptive equipment for single-handed use or for use with their myoleptic prosthesis. Most commonly, that's where you would find me on the other OTs, is at somebody's home or somebody's workplace. So we do a lot of our assessments in the home. So when we do a multi-disciplinary assessment, they might come into the clinic to see the prosthetist and the physios and the counsellor. And then I will do the occupational therapy side in their home environment because that's where they need to be functioning. That's where function happens. So it makes more sense to do it at home. And we do a lot of the training, whether it be myoleptic prosthetic training, we'll do that at the patient's home as well.